Is your knee not going straight after ACL surgery and you're not sure whether you've got something called a Cyclops lesion or you're actually doing bad rehab? Well, in today's video, I'm going to explain exactly my thoughts and opinions around Cyclops lesions and hopefully help you understand whether you potentially have one or you're just doing bad rehab. For those that are new around here, I'm Tilly Milverton and I'm a sports therapist and I specialise in ACL rehabilitation. Non-operative or post-operative, standard, average Joe people that want to return to life or amateur sports, but also quite athletic individuals that's either semi-pro or playing professional sports. Let's get into it. When you have ACL surgery, lots of you, I'm sure, are either had it or about to have it. The key most important thing for you to do post-surgery is to get your knee straight. Now, why do we always harp on about that? And if your therapist isn't harping on about that, throw them in the bin and find a new one. If your knee doesn't go fully straight, what we call terminal knee extension, that end range extension, your quadricep is driving your knee into full extension, you sit with what's called a fixed flexed knee. That can be anywhere from 5 degrees to 25 degrees. That is not good because if we're not getting the knee straight, our quadriceps are never fully contracting. That means quadricep inhibition, i.e. them not working, is going to be even worse than it would normally post-surgery. You're going to get more knee pain because you're hobbling around on a knee that's not straight. You're going to get biomechanical issues, the calf, the hip. It's not good to walk around on a fixed flex knee, but also swelling isn't going to come and go, and you get a higher risk of scar tissue building up within the knee. Now, what's really key is that post-surgery you get full extension. But that's not what today's video is about. Today's video is about me explaining whether you could have a Cyclops lesion or you're just not doing very good ACL rehab. So if you're watching this, I'm assuming that you don't have full extension yet, or your therapist keeps pushing it into full extension and you're perhaps losing it, or you're just being told to hang off the edge of a bed and just have agony for the following 10 minutes to get your knee straight every day and you quickly lose it. Cyclops lesion, what is it? Cyclops lesion is a scar tissue that builds up in the knee. It can be from just post-operative changes and it can just occur because the knee's got excessive scar tissue in it. It can be from the fact that the old ACL graft hasn't been kind of chopped away, drilled away, left, and there's a small notch that's making it too tight for the new ACL, and the old ACL, the bit that's been left, hasn't been removed properly, often just stays there and it annoys the current ACL, but it also makes your knee go into what's called a mechanical block and you'll never get the knee straight, or it will never stay straight, and you'll have front of the knee pain, i.e. anterior knee pain. So what's absolutely important is that we can try to differentiate between the two because Cyclops lesions are rare, okay? Don't watch this video and think, that's it, I've got a Cyclops lesion. The likelihood is you probably haven't, but, and this is a big but, I've been practicing now for 6 years and I've probably seen 18 to 20 Cyclops lesions, but I've seen the majority of those in my past kind of 12-18 months, where I've seen lots of patients for second opinions because they come to me and say, I can't get a knee extension, my physio's just telling me to keep going, I'm 6 months post-op, my surgeon's telling me to keep going, you say on your social media that you shouldn't be forcing knee extension all the time. If you are, there's a problem, or you're not doing the right exercises, can you help me? So I'm seeing more of them because I'm getting more and more problematic ACL cases landing at my door, because I'm not sure if you're aware watching this, but ACL seems to be a bit of a key word on Instagram, and there are so many now cowboys doing ACL rehab and just butchering it so that people are paying a fortune and not having actually good ACL rehab. They're then slow to be referred back to an expert that can actually help them if they do have something called an extension lag, i.e. an extension deficit. They can't get full knee extension. Before I ramble on and lose you, I want this to be as simple as I can, but I can't just give out random advice and just information on a Cyclops lesion. It needs to be quite structured and quite serious so that you don't all leave this video thinking that you've got a Cyclops lesion. They're not that common, okay? They are quite rare. However, if you are 2 months, 3 months, 4 months, 5, 6 months post-op and you are doing proper quadricep drills, proper gait drills, i.e. activating your quads every 2 to 3 hours throughout the day, 4 to 5 times per day, your quadriceps are working really nicely, you can feel them working, you're doing your gait drills, you're doing good rehabilitation and your knee is just not going into extension, you know, you're working really hard. That's the point. I would get an MRI scan, because that's the only true way of diagnosing a Cyclops lesion, is to get an MRI scan to actually have a look. In most cases, when patients come to me and they say, you know, I think I can't get extension, I'll get them to do my extension drills for 7 to 14 days. If they improve in that period, I know they've not been doing the right exercises. This is the most common thing I find, right? But if it doesn't improve, or if in clinic I cannot get it into extension, you're going to get an MRI scan, because that's when we'll know there's a Cyclops lesion. Majority of the time, it's bad rehab, i.e. you're just being told to force your knee into knee extension, which just makes the knee cranky, it makes it unhappy. You're not working the quadriceps to actively drive your knee into full knee extension, therefore it will never stay. Anything that's forced just won't stay. Think about it. You shove clothes into your wardrobe, can't bother to put those away. I'm going to throw them in there. I'm going to shut the door really quickly. Eventually that door opens, doesn't it? And eventually everything just falls out. Whereas you fold them, put them all away nicely, shut the door properly. Same with ACL rehab. Stop shoving the knee into full extension. Actually do exercises that will help hold it there. Muscles will grow, and naturally it becomes just a normal part of your day that the knee goes into full extension. But you cannot progress through your ACL rehab without full knee extension. You can't return to jogging, you can't return to the gym, you can't return to sport if you don't have full extension. It's a very common problem, and we must get better at dealing with it. When you think about all the things that you go through with ACL rehabilitation, you would think that regaining extension would be something that's so simple and so easy, but it's not. Let's recap very quickly. You're doing really good rehab exercises, full knee extension drills, quads are working, quads are active, knees still just not going into full extension, it's hurting, you've got a clunk, a clicking, pain at the front of the knee, extensions coming and going, candidate for an MRI scan. You aren't doing proper ACL exercises, you're intermittent when you do and don't do them, you don't have full quadriceps contractions, your rehab plan is just an exercise sheet telling you to do random exercises, there's no element of progressive overload or you actively working your quads, you're doing quite bad rehab. You need a better therapist. So one side is an MRI scan, the other side is better therapists. Listen to your gut, your intuition. If you think there's something wrong, raise it. And if you're being fobbed off each week and saying, just keep working at it, and you know hand on heart that you're working really hard and the exercises you're doing look correct, something's wrong, something's amiss. Cyclops lesions are quite rare. They're not something that happens all the time. Please don't watch this video and think, right, that's why my extension's not working. Perhaps look at my complete ACL recovery guide that's helped hundreds of people regain not only extension but flexion, as well as return to the gym, return to running, get rid of swelling. It's a complete step-by-step guide, step-by-step plan to help you go from kind of pre-surgery, post-surgery, return to run, return to sport, all mapped out with video exercises, know exactly when to progress and how to progress. The levels of exercises get increasingly harder as long as you pass the levels of progression, so you're not guessing, you're not waiting for a therapist to tell you what to do, when to do it, or more than likely not when to do it because they just forget, or they forget to send you a program, or even worse, they have you go every week to do rehab with them and you're not seeing any progress other than your bank balance going down. If you found this video useful, please don't forget to like and subscribe, and drop me a comment if you want more on Cyclops lesions, like what does the rehabilitation program look like after you've had a Cyclops lesion removed. If you want to see that video, comment, and hopefully I'll be able to get some more of these videos out.